Myself Shrestha Shai. I'm a OBG nursing, OBG in MSc, OBG MSc in nursing, and today I will discuss some myths in obstetrical nursing. So these myths are coming from the DICE practices. Those who have no formal education, from that time also this has been carried out. Nowadays, government has planned many things like midwifery lead care units. There are many teaching programs and developmental programs in practices trainings. Though there are developmental programs, but nowadays these myths are being practiced nowadays till now also. So let's discuss 2-3 more myths. Like first is fundal pressure. As we have seen in labor room, basically the myths are practicing in labor room only. The fundal pressure, we have seen that if there is no contraction, even giving after oxytocin also, if there is no contraction, the DICE, basically the attendants, they ask to push the baby when the contraction come. What happened that time? Contraction doesn't come and unnecessary there is a hard push. For this there are many even inertia, rupture of uterus, many fatal conditions arises. And what I suggest, what the Indian government also suggests, there is no need of fundal pressure. Automatically the contraction will come. If the contraction will not come, do partograph. If the partograph, in partograph it will cross the alert line, go for action line, then consult the obstetrician who is present or physician who is present there, and go as need as the need based care. Okay, so unnecessary fundal pressure may cause many fatal conditions like uterine rupture and all these things. Then we will discuss about cord squeezing in the third stage management. So before we can see, after cutting the cord, old people, they used to squeeze the blood to the umbilicus of the fetus, or till the baby has been born. So we can say the baby. It is totally unnecessary, because after 3 to 5 minutes we are cutting the cord and all the pulsation has been stopped. There is no need of squeezing of blood. Even we squeeze the blood, what happened, there can be a small rupture or anything, injury can happen to the baby. So there is no necessity of squeezing of the blood. Next we will discuss about the baby crawling. Before we are practicing, even in our practice book also we can see, the after the delivery of the baby should be placed over the breast of the mother. Nowadays people are, it's been in research also, we are not practicing, but we have seen that even if the fetus will be placed on the mother's abdomen, the fetus will crawl itself to have the breastfeeding. So and the fetus should be allowed to crawl, because it's a reflex both for the mother and the fetus. It's a pituitary reflex both for them, so it should be allowed. One more thing I will discuss, that is counter cord traction. It's another malpractice condition in counter cord traction, because when we have seen that placenta is not separated yet, and there is no hardening, means no contraction is there. If contraction is not there, placenta is not separated yet, unnecessary we are like pulling the cord and this much thing, what happened, cord can be torn out. If the cord can be torn out, what will happen, placenta will be still remain in the fundal part only. So we have to move the patient immediately, or the mother immediately, to the OT, and unnecessary cesarean section will be done to remove the placenta. There, even the manual removal of the placenta will be very difficult at that time also.
So no problem that it takes time to come out.
That takes time to come out. It can be 15 minutes. In theoretical, it can be 15 minutes, but we have seen in priming gravida, it takes more, like 20 to 30 minutes it can take. So we have to have some patience until
no need to give the pressure, fundal pressure.
Fundal pressure is totally absoluted. No need to give any fundal pressure before the delivery of the baby or after the delivery of the baby. We have to wait. What we can do, we can give some massage to like pronounce the contraction or something like that, or we can provide the oxytocin. We can put some methargine. What will not methargine, actually oxytocin. MTSL is totally based on oxytocin. So the amount of oxytocin can be increased. That much we can do, but no unnecessary like there is no contraction, nothing else, and we are pulling the cord, the torn of cord will be there. So retained part, and the most common disease condition that can occur by these myths and malpractices is the PPH. postpartum hemorrhage, and maximum fatal cases, maximum maternity mortality rate of the mother in postpartum mother is the PPH. You can know that. So
Okay, what about episiotomy? Is it correct?
ma'am, before days we had been taught, even we know that episiotomy is mandatory. Okay, nowadays we are not like telling episiotomy is mandatory even in primary cavity also. If we have enough space.
Because I had a severe pain. Episiotomy. I was thinking that why I might have
No,
gone
for
for a
that-
cesarean section rather this.
No, for that lignocaine should be introduced in nowadays in PHC also. We can see no one is giving lignocaine to the fourth sheet also, but the common practice is lignocaine should be given before the episiotomy.
Can you tell something about the forceps delivery and other cup delivery?
Forceps delivery is also nowadays, these are the instrumental deliveries. Forceps delivery and
I
the
have seen,
vacuum extraction of
vacuum
the
extraction.
extraction. This has been absoluted. Forceps delivery is totally absoluted. Vacuum extraction also been absoluting in the way of absoluting. But in forceps delivery, there is a procedure of forceps delivery: how to hold the baby, where to hold the baby, when we will introduce the obstetrical forceps, in which way we will introduce, like the handle of the not handle, the cup of the obstetrical forceps should be holded here in the neck of the baby. It is a big thing, ma'am.
Okay, one more thing I have a doubt. Only cephalic presentation you will go for the normal delivery, or if it a buttocks
No,
delivery?
doesn't matter. We have to see whether there are in breech delivery also, breech presentation also, the mechanism of labor is
Going to be
different.
different.
But going to be there.
Same.
So if the condition of the mother's pelvis and the space of the mother's pelvis is well and it is not contracted at all, for breech delivery it is not contracted, we can go for normal vaginal delivery.
Even the buttocks presentation,
Even the buttocks or footling presentation.
footling presentation.
Any breech presentation.
Any breech presentation you can go.
Not in the soldier presentation. In soldier presentation, it is very tough. I never see, even I can never imagine
So
also.
once the buttocks presentation, once the buttocks coming out, then the head will be automatically the way will be very.
In mechanism of labor, only head and shoulder is involving, but in normal mechanism of labor. But in breech presentation, in mechanism of labor, first the buttocks or the pelvic area of the fetus, then the shoulder, and then the head will be not coming. It will be engaging as a mechanism of labor. In prior, in the normal mechanism of labor, only the head and the shoulder is doing some work or some.
Okay, sometimes cord presentation, cord.
Yes, ma'am.
Cord around the neck. What will
Cord
you do as a
around neck is another thing. Cord presentation is another thing. In cord presentation, there are three things. One is cord presentation, cord prolapse, and occult cord. Three things are there. If there is cord presentation or occult cord, that is manageable. But if there is cord presentation or dropping down or cord prolapse or dropping down of the cord, the chances of fatal chances are there. So if there is any chance of cesarean section, mother can go for cesarean section. Unnecessary pulling the cord, that is the most vital thing. We never pull the cord if there is cord presentation or something is there. And if there is cord around neck,
yes,
that's why in this time when the second stage of labor is coming, the crowning, after crowning, when the head is delivered, we have to check the cord around, if there is any cord around neck or not. In introducing two finger, we have to check. If as we can know, it is very slippery in that time, so we can remove it, the loop we can remove, or it will be tightly enclosed. There is sinuses, we can see central sinuses is there, then we can immediately cut the cord. There is no need of wait.
This cutting the cord is during the delivery process.
During the delivery process, when the head will be, in maximum cases we can remove the cord. In maximum cases it is there. If there will be any adverse case, the cord is too much tight, cannot be removed, we can cut the cord.
Any myths about the amniotic fluid, like?
Ma'am, actually the amniotic fluid, from where it is been introduced, from where it is been going on, and how it is oligohydramnios or
where the amniotic fluid is secreted. For example, CSF fluid is secreted from the brain. like
it is-
choroid
it is
plexus
in-
of brain.
Yeah, choroid plexus of brain. It is been till now it is in research work. We cannot tell, but there are many. If I search, there are many things that will come out. But still, the exact center of the amniotic fluid secretion is not known.
It's myths about that. Okay. Sometimes they are telling the baby will be swallow the amniotic fluid. How it
Then,
is possible? It is.
it is also myth. It is also under research that if the baby will urinate more,
More.
then there will be polyhydramnios. It is been saying that, but still, as I am telling about the amniotic fluid, all
Okay,
things are
that some
research.
people are telling amniotic fluid insufficiency is there during
That is
pregnancy.
oligohydramnios.
How will you overcome that? Is there any intervention? Is there what advice as a midwife you will
Yeah,
give?
there is nowadays it is been introduced that amniotic fluid infusion. It is there, amniotic fluid infusion, but it is very rare procedure and it is very costly. So nowadays we cannot do that. Only we can tell, we can suggest the mother to hydrate herself.
If you drink more water, automatically your body amniotic fluid will be increasing. Okay. Any other myths important?
That's for this time. That's much.
So you will continue next video with another myth?
Okay.
There are myths are there still?
Myths. There are still myths.
Myths. Okay. Thank you so much.